Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
I'm doing pretty good, Dalton. How about yourself?
I'm great. I'm excited we're back and talking. We got our coffee here. I got some cold brew today. Homemade cold brew, actually. I made it myself, so we'll see how that tastes.
Look at you.
Yeah, I know, just stepping out in the world. But I'm more excited about the interview we have today. So we're going in a different direction, guys. This is new for us. This is a topic we don't know not really anything about. But we're talking to one of our classmates, Lydia, and her clinical instructor, and she's currently doing her placement as an animal physio, which is awesome. So we're gonna sit down and talk with them. Her CI's name's Carrie, and she is an animal physio at the Kempville Canine Center. Is that correct?
That is correct.
Awesome. So Lydia, Carrie, welcome to the show.
Thank you. Thanks for having us.
No problem. We're excited. So let's just start off. We'll have let's just have Lydia. Why don't you just introduce yourself? Tell everyone a little bit about who you are, and then Carrie, you can do the same thing after that.
Sounds good. Sure. So I'm Lydia, and my classmates know me as the only person in class who wanted to work on animals. So as soon as I found out that that was an option for physios, I went for it. And I'm in second year. I'm about to graduate.
Woo woo!
2 days left now, which is pretty exciting. And yeah, as Dalton said, I'm here in Kemptville, Ontario, in one of the only PT clinics for animals in the country. There's only 3 that are standalone physio clinics for animals, and this is one of them.
Whoa!
All right, so I'm Carrie. I am one of the owners of Kempville Canine Center, and we share a wall with our human clinic, Kempville Physio Center. So we're super excited for Lydia to be here because one of the goals in animal rehab is to get young therapists starting to think about animal rehab and understanding that it's out there. So we love having students, and we've had a couple from the University of Ottawa because we're just south of Ottawa. Lydia would be our first Western student, but we really want to encourage all of the universities to be asking their professors if they could do these placements in canine rehab. And I am the co-chair of the animal rehab division of the CPA. So we have been a CPA division for quite a number of years. And one of our big mandates is to increase our popularity and increase students learning about canine rehab. And I have to say, I'm very impressed with Lydia. Not only she has great skills, but I think you should tell them how you came about and where she lived for the first week.
Let's hear the story.
Let's do this.
It's a long story. It will be published in the newsletter, actually. But to give you a brief synopsis, I had to talk to 2 different academic clinical education coordinators to get this placement. They told me yes, then they told me no, then they told me maybe, and then they told me yes. And essentially, I didn't find out about this placement, even though I had kind of booked it in a way. I hadn't found out that I got it until 3 weeks prior to needing to move.
Nice.
So Kempville is a tiny town. It's not like London where you can just grab a rental property. Nothing was available, or nothing was within my price range. So I camped. I camped in a campground for the first week.
That's awesome.
I rode my bike into town, which was 30 minutes. Yeah.
And it was a borrowed baby bicycle.
Yeah, it was like a child's bike.
Didn't even fit her.
No, it was super uncomfortable. And then after that, after a few days of that, some raccoons got into my supply tent, and they ate all my bread, and they munched all my crackers, and they were just, they were the worst.
Oh my God.
so I had to figure out a new plan. And luckily, around that time, a bunch of people were feeling sorry for me, and they were like, "Hey, we're going on vacation. Can you house sit?" And I said yes. So I've been house sitting for the last 4 weeks.
Yeah.
At various places.
Four different houses probably. Every week she's at a different location and bikes in and
figures it out.
So one thing I wanted to say is that this young woman is going to go far in life.
Yes, she is.
Because she decided this is what she wanted to do. Got it done, right? She didn't, so a lot of people would have said, I have no place to stay. I don't have a car. Her boyfriend dropped her off with her pup tent and a bike and a cooler of food and left her for 6 weeks, right? So, if you want to do something, just do it, right? Don't wait for someone else to figure it out for you. Just figure it out yourself. And then once you got here, we're a small town. Everyone knows everyone. People were coming off the street saying, "Hey, do you need a place to stay? Because we heard you were camping." So it's all been good, since then. Yeah.
Wow.
Well,
that was an incredible story.
We're glad you're okay, Lydia. You're safe. You're still alive. That's good. But yeah, I think that's a great point. Like the dedication to going after something that you want. I think that's one thing. Having a bunch of these conversations has showed us that, like, if you want something, you have to go and create your own opportunity. So that's awesome.
Yeah.
Yeah, and so I have a question for both of you guys, actually. Obviously, it's like challenging getting a placement in animal rehab. So what advice would you give somebody who is maybe considering going that avenue and wants to get a placement, and maybe so they don't end up camping? I don't know.
Yeah. Excellent.
Live in Calgary.
Yeah. So there are 3 standalone physio-owned clinics in the country. That's it. Us, just outside of Ottawa. There's one in Niagara, and there's one in Calgary. But there are a lot of physios who are working within vet clinics, or they do barn visits for equine and that type of thing. So all of the students have access to the divisions, right? And if you go on the Animal Rehab Division website, there is a list of practicing physios who are treating either equine or canine. And you can scroll down that list and find someone in your area and then probably contact them directly. I think what would happen is the university doesn't really want you to do a full-time animal placement, but share it with the humans. So it's convenient for us because we're right beside each other. So Lydia was doing 3 dog days a week and 3 human days a week. We made her work 6 days a week too, by the way.
3 human days.
Yeah, it was awesome. 3 human days, 3 dog days. So that kind of helps the university accept this as a placement. And most of the other placements you would do would also have access to a human placement for you. Because in canine rehab or animal rehab, we are not under our colleges. We are under the vet colleges. And so our colleges don't consider animal working hours as part of the mandatory hours that you have to put in as a physio every year. And so it kind of precludes any of us from working full-time on animals. So we can, all of us kind of do 1 or 2 human days a week and then the rest animals, so that we can still fulfill those human requirements. So all of us have access to a human clinic. So for students, you would just split that placement between both clinics. But on that website, it's called Find an Animal Physio, you would be able to access someone in your own province.
And to add to that, as a student, that's exactly what I did. So I went on there, and it was actually another classmate idea, because last year when we had a month break, I'm from Calgary, and she was like, "Have you looked online? All of the animal PTs are in Calgary." And I was like, "Oh, I should go look that up then." So I did, and I organized a shadow for myself with an equine therapist and a canine therapist. I figured out that yes, this is not a crazy thing. Yes, I want to do this. I just need to figure out how. So then that's when you have to talk to your academic like clinical education coordinator, because they have all of the cards. You can't be contacting these clinics and these people and expecting a placement. Like, the university doesn't want you to do that. That's not the rules. So you have to tell them, this is what I want, please do it for me. And then if you have all of your requirements in, so you have to be like strategic from day one. You have to be like, okay, like we needed neuro hours, acute care, we needed like a hospital, we needed rehab, we needed 2 clinics. So you have to know from day one, and you have to be like, okay, I'll have all of those done by placement number 4, and then placement number 5, I can have these like extra little hours as canine, because otherwise it's just a hard no. It's a nope, you can't do that.
Yeah.
And so then what happened was I went to Western, and our catchment area is Ottawa.
Yeah.
Western had to contact U of O to see if they had any students at our facility, and if it was okay for them to approach us. So that all had to be cleared first. And then we had a message from the University of Ottawa. We're like, yep, fine, no problem. And then her clinical advisor contacted us directly saying we have a student who's interested in canine rehab.
Yeah. So lots of groundwork.
Yeah.
Yeah, for sure. So
it isn't a
go ahead. No, go ahead.
thing. It's something you would do really in your last orthopedic placement, because you have to already have a good grasp of what to do on humans before you can treat a dog, because we make you practice on humans first, because dogs are way more important, right? So,
of course.
Make all your mistakes on the human side and the dog side, because dogs bite if you aren't careful.
This is true.
And,
some humans bite, but
canines a little bit more advanced, just because you don't have that verbal confirmation of anything, right?
Yeah.
You got to be able to read their body language. You got to be able to feel the tissue. You got to be able to know the end feels, so that you know when to stop, and you're not going into an end feel that's into spasm and that dog is going to react. So you already have to have some good palpation and some manual therapy skills already before you would come into a canine placement.
And I think Western really helped with that, since we have a great manual therapy program that not a lot of other universities get. So I had decent hands going into it, and it benefited me hugely here.
Oh, we can't hear you.
Oh no, his audio is gone.
Yeah, Dalton, you're quiet.
Type in your question. There, you're back. You're back. Okay. Nope, can't hear you.
We can hear you, Will. You have to read
Yeah,
his
that's
lips.
weird. We'll wait a second.
What about now? You hear me now?
Yep.
Yeah.
Okay.
Exactly. Yeah. Just
I'm back. All right. So what I wanted to ask you was, before we get a little farther on, why don't you just take us through like a typical session and kind of what it would look like, just to give the listeners a little bit of a better idea.
I posted about this recently, and if you imagine any human assessment, that's what a dog one looks like. First, you get your patient to come in, although there's lots more treats with the dogs. You have to, you give them some treats, you pat them, you make them feel comfortable. And then
you give them a big kiss.
Yes.
And don't do that with your human patient.
If you don't want to get reported to college.
No reporting.
Really like in-depth to subjective from the owner, because we deal with most of our patients are athletic. Most of them are sports or working dogs, or and their owner spends so much time with them that they know that something's going on. And most people would be like, so you have to talk to the owner first. They tell you what's going on, what's happening. And then after that, you do the objective, and you take them through ranges of motion. You test some joints. You have to do a lot of manual therapy on them, because sometimes the owner's like, oh, their gait's weird. And you're like, okay, that doesn't tell me much. They're walking strangely. Okay. So you watch them walk, and you're like, they are walking strangely. And then you have to try and pinpoint, why. So then you have to go through, is it front end? Is it hind end? And then, it was none of those. None of them are tender on palpation. None of them have strange ranges of motion. None of them are, no obvious signs that there's something wrong. And then you're like, okay, maybe I'll look in the spine. And then finally you find some reaction. You're like, aha, it's a back problem that's leading to this. So anyway, my point is, after that, and you treat the problem that you see, it's exactly like humans.
They have the same reflexes, and most of the bones are the same. We call it as human physios, we learn 2 legs, and as canine therapists, all we have to do is, or any animal therapist, we just really have to go from 2 legs to 4 legs. Because the anatomy is really, really similar. The joints are all pretty much the same. The muscles are all pretty much the same. The nerves are pretty much the same. When you get in and start taking more canine or equine courses, then you learn a little bit more of the subtleties in the differences of anatomy and things. But really, it's like treating a young kid who can't talk to you, so you've got to go by how they react, right, or what happens. And so it's more relatable to pediatrics maybe than like a normal adult person coming in. Yeah,
that's awesome. That leads me, I've been dying to ask this question, because a big thing that comes up on our podcast is communication, and obviously in our field that's so important. So I'm so curious to hear how obviously you're not barking at the dogs, unless you know how to speak their language or something, but there must be some unique ways that you communicate with the animals. And even with the, I guess you also have to communicate with the owner, who obviously cares a lot about the animals' outcomes. So take me through, how do you guys kind of communicate with the animals?
Right. So what I think is that you're either an animal person or you're not. So it's hard to tell people who aren't how to communicate with animals, because it comes naturally to people that enjoy them. But basically it's all in your body language. So all of our patients, you need to come off as non-threatening. You have to be their friend. You have to be able to let them know that you're here to help. And a lot of that is just in your tone and in your facial expressions and in your body language in general. And then once they trust you and they know that you're there to help, then they kind of allow you to put your hands on them. And plus you're feeding them treats, so they're all happy and they let you do what you want. And then you can kind of read from them what is going on and what might be causing them pain or discomfort and things like that might be an issue for them because of just like their muscle tension, or when you bring them through their ranges of motion, if they try and sneak a leg away from you, if they do any kind of avoidance behaviors, if you try and get them to stand and they say no thanks and they sit down, or they just look at you and it's just a look and you just know they're thinking, what are you doing? Why are you doing that to me? I don't like that. So that's all I have to say about that one.
So when you take the ARD courses and you take your intro to canine or equine rehab, part of what we really focus on is safety, right? So that's one of the first things you have to understand is how to approach an animal, how to be safe, how not to get bitten. If we have time, I'll tell you a hilarious story of my only bite. So, because that's a question I get asked all the time. But one of the big things to know is when the animal comes in, and often they're in pain, so they may be a bit testy, right? And we never let them socialize with any other animals, so they're always on leash. And we don't let them play. The clinic is not an area for them to play in. So they're on leash, they're with their owner. And one of the big things you start with is you totally ignore the dog. You talk to the owner. You let the dog wander around the clinic. They can sniff. You don't even acknowledge them. And when they know that you're familiar with their owner and their owner is having a pleasant conversation with you, then you are not threatening to them, right? So, because a lot of dogs are reactive and protective, and so you just don't even let the dog be part of the conversation, because we want to know the history from the owner. What happened to the dog? I don't need to look at the dog initially to know any of that stuff, right? So in kind of reactive dogs, we just really let them kind of set the pace. And most times there's no other dogs in here. There's just them by themselves. Occasionally on really busy days, we might have 2 therapists, and then we're extra careful about keeping them on leash and not letting the dogs play. But generally they're by themselves. There's lots of good smells. And this clinic, or probably any physio clinic, does not smell like a vet clinic. We don't use antiseptic. We don't put stuff up their anal glands. We don't wear white jackets. We're a fun, it's all equipment, it's all treats, it's all a very fun experience. And usually after the first time when they come back again, they can't wait to come to the clinic. Like the people turn off the highway and the dogs are up on the dash crying to go in for physio. So
that's awesome.
I have one dog in particular. I see him every Friday morning. He's like a 14-year-old. And he knows when it's Friday because he gets his owners up early. He goes, gets his own leash. He waits at the door. He doesn't even want to have breakfast because he gets to come to physio. So it's the dogs really enjoy it. So it's really, really funny. And so anyway, once you kind of talk to the owner and set the tone, you never come up to a dog, you know, like this, and you never pat them on the top of the head. It's always let them sniff your hand, hold your hand down low, let them sniff it, have some treats, let them get used to you. We do all our assessments on the floor, right? So we don't put the dog up and put the dog on a plinth or a treatment table. So we come down to their level. They can move anytime they want to. The owner's there, and it's a pretty relaxed environment because we never want the dog to be, we never want to cause the dog more pain. We need to find out what's going on, but we don't want to cause them any pain. Right. Whereas with a human, you know what, sometimes we cause pain. Right? We're doing an assessment, you've got an acute disc, you know what, I'm going to go into an irritable disc, I'm going to cause some pain because I need to know those objective signs. But with the dogs, because they can be reactive, we're a little bit more careful. And sometimes your assessment is over a longer period of time because they need a little break. They walk around the clinic, you give them a little treat, they have a little pat, they come back to the mat, you know, and they've sort of settled down a little bit. So, but very, very quickly, they love coming in. Yeah. So it's a really different experience working with dogs. Yeah.
Yeah, I mean, I'm curious.
You guys dying to ask questions.
Yeah, that was great. That I'm sure Will feels a lot more comfortable now. He's okay. I'm curious to hear, Lydia, since like you're spending sometimes treating, you're treating humans and you're treating dogs. In terms of like the communication strategies and the way you're communicating, have you seen like a lot of crossover or benefits in the way that you try to like establish that relationship or communication with your patients?
I haven't found that. I think I'm lucky. I don't think it's terribly hard to talk to people. So I feel like there's a lot of crossover because not only do you have to treat with your human physio, you have to educate the owners. You have to go through the same steps. You have to make them feel comfortable. You have to make them understand what's going on. They have to be part of the whole treatment. They are part of the plan of care, basically. Yeah. So I think there's a lot of crossover as far as that goes, and as far as, you know, just the communication with your patient. I think it comes down to the same thing. Have you ever tried to look at range of motion for someone with a really unstable shoulder? Like they do a bunch of muscle guarding, you have to make them feel comfortable. You have to make them feel okay. They have to trust you, and then they'll let you assess them. So I think it's a lot of crossover.
Yeah.
My biggest crossover is I really only treat owners of the dogs that I see. So I just talk to them about their dog and they'll let me do anything to them.
There you go. Now, the reason why I asked that question is just listening to the way that you talked about like interacting and communicating with a dog. A lot of the key things that you said, I feel like are important when you're interacting with humans as well from a physiotherapy perspective, you know, like making them feel comfortable, trying to establish that relationship, trying to help them feel less threatened, like all of those things. The only thing you need to add in is start giving them treats. And I think it's game over for human interaction if we start giving humans treats. But I just, I just think there's a lot of crossover. So that's why I asked.
I treated a pig one time and the pig would only perform for beer and pretzels. So we gave him beer and pretzels as I was treating him. So then all my human patients now want beer and pretzels when they come in for treatment.
That's fair.
You got to set that expectation right away.
Yeah.
No beer and pretzels. Only on Fridays.
And I think I should add on, only Fridays. Just to add on to communication, I think one of the big things that, imagine being a physio is, physios listen to their patients. You know, they run it. We hear all kinds kinds of stories, with other healthcare professionals. The doctor decides what's wrong. They don't really listen to what the patient is saying. And I think it really is important, especially in the animal world, is the owner knows their dog. The owner knows, even though they can't diagnose it medically, they can tell you what's going on. And as long as you listen to them and don't poo-poo them and say, oh, you know what, okay, yeah, fine, that's what you see, but I think this is what's going on. That's a big thing that physio does, right? Is allow the owner or the human to say, here's what I think is going on, and we can agree with them or help them to figure out why they're having their pain there, So I think listening is a really good skill that physios have.
I agree.
Awesome insight. I totally agree with that.
So with regards to like having a student, Carrie, I'm just curious to hear, what are some of the main things that you try to get across to your students, or wisdom you try to impart on the students that come through your clinic in order to set them up for success as they go into the actual profession?
Right. So in Canada, just recently, we have developed a whole diploma program in canine rehabilitation. And so when I went through my training, there was nothing in Canada. We had a couple little courses, but nothing really structured. And the ARD has done a really good job in creating a whole stream of courses and a whole diploma program. So I think what like Lydia needs to know and other students need to know is there's a whole lot of support out there to help them get into this type of the profession, because there's a series of courses, there's congresses, there's mentorship, which, like, those of us who are older who have been doing this for a while didn't have any of that mentorship available, right? There were no physios doing any kind of animal practice when I went through school. So, and I'm a Western grad, by the way. You guys pass my picture on the wall every day.
That's amazing.
So there's a whole bunch of things that are available now, and in the newsletters we give lots of information about how to start your practice, because these therapists now are still kind of trailblazers in their area, right? Even though animal rehab's been established for a little while, I don't think there's anyone in London. There's one person in Toronto. There is nobody east of here. Like, there's nobody in PEI. Well, one person in Halifax, right? It's so scattered that anyone who is now taking on these animal rehab courses is still a trailblazer when they move to Penticton and when they move to Prince George and when they move to Orangeville, right? There's nobody doing it in their area. So you're creating your own job, right? So we know everyone's going to be probably working part-time with humans, but if you want to treat animals, you got to get out there. You got to talk to the vets. You usually would work in a vet clinic to get started, probably doing post-op stuff, because that's really, really easy for physios. It's kind of our bread and butter. We do it all the time. Mm-hmm. And a post-op dog is no different than a post-op knee replacement. And the ACL is the #1 orthopedic surgery in a dog, right? And so even if you just go into a clinic and start treating ACLs, it's fantastic. So 20 years ago, when I did a presentation for the local vets, when I was just starting my canine practice in Ottawa, I did a rehab presentation for them on cruciate injuries. And we know from humans, like, I work with the national rugby team, and we had one of our players go from a complete tear and a cruciate repair, and literally 12 weeks later was playing World Cup, right? That's how quick now the rehab is. Jeez. And in the vet literature, I was reading up on a whole bunch of things, and the textbook had about 100 pages on the surgical technique for the ACL and one paragraph on rehab. And the paragraph said, create rest for 6 weeks and return to full function at 12 weeks, period.
Nice. Oh, man.
So they know nothing about rehab, right?
Yeah.
And now we have all the things to help our people put together really good programs, because the vets are about 30 years behind human medicine. And the vets don't, they know they're fantastic surgeons, but your orthopedic surgeon in the human realm is not going to do any of your physio, right? The physios are the experts in that. So our challenge as animal rehabbers is to get that information out to the vets and make the vets understand that we are the experts in this. And that's what we want these guys to be doing, because they are, even at a beginning, you still have all of that human background with you, and it's the same thing. Right. So Lydia can walk in tomorrow to a vet clinic and be able to help them with the post-op.
Yeah. To add on to that, it became shockingly clear how much more qualified, to put it bluntly, physios are to treat rehab than any other profession, regardless of the species. When we talked to not only some vet technicians, but also a vet herself going through a rehab program, she was telling me that hers was like weeks long. And, I've had my 5 weeks here, but the 2 diploma courses can be done within, I think they're both weekend courses.
Yeah.
So they're both weekend courses. So as a physio, basically all you have to do is learn the anatomy and the physiology and, just get that kind of information. And then common conditions, common things that you might see, blah, blah, blah. But we know what exercises to do. We know how to strengthen a system incrementally. We know all of this stuff. It's ingrained in us. So we know like ACL, Fowler-Kennedy post-op, like procedure week 1, week 2, week 3, week 4, like then you just take that, put it on 4 legs, there's your dog. Mm-hmm. And it's really interesting. Like we're the experts. And it came out when I was talking to these other animal experts, how much better we are at rehab than they are, unfortunately.
Yeah. And there just aren't enough of us out there. So that's why we love this kind of interaction, and we love students to come in and start learning about it and start their careers right from day one, half human, half animal. Yeah. You are the experts already.
Yeah. No, that's a good point.
I feel like we have to hear your dog bite story before we kind of continue.
Okay. So, and often people ask me, have you ever been bitten? And I have only been bitten once, and it was by a quadriplegic cat. So this cat was born with all kinds of allergies, probably shouldn't have survived kittenhood, but anyway, survived. The owners are 2 sisters. They just love this little cat. Anyway, they take the cat to its first set of shots. It has a huge reaction to the first set of shots. So the vet's like, okay, you can't do any more shots on this cat. He's allergic to everything. So he goes along fine for about a year, and he gets stung by a bee. So he's allergic to the bee venom. So he goes into anaphylactic shock. They rush him to the vet clinic. They give him the antidote. He's allergic to the antidote.
Oh my gosh.
So this cat goes into complete meltdown, right? And he becomes a quadriplegic. The only thing this cat can move is his head. So I see him a year later. So for the last year, the sisters pull him out of his little orthopedic cat bed, take him to his special cat litter, manually express his bowel and bladder, take him to the food dish, let him eat and drink, take him back to his orthopedic bed, come home at lunch and flip him over because he's going to get bed sores otherwise, do the same thing. So it's not my place to tell anyone when to euthanize their animal, right? That's the number one thing to learn. That is not our scope of practice. So if they think they can try to treat this cat, I'm all for it. So they come in a year later, and you can imagine how stiff this cat is, right? He hasn't moved for a year. And my question was, what do you think I'm going to be able to do for this cat? So they said, well, we don't know. The vet thought maybe acupuncture might help or exercise might help. So I'm like, okay, I've got to try, right? They're my clients, not my call what to do with your cat. So I have this cat on my lap, and I, first of all, showing them some passive range. Like if we're going to do anything with this cat, we have to get some mobility in his joints, right? Before anything's going to happen, because he's like this, right? On all 4 legs. So I've got him in my lap. He can feel me bending his elbows. Like he had some movement, but he didn't have any, he had some passive movement, didn't have any active movement. So I'm showing them how to get his joints moving. And he's feeling this. He's meowing. He doesn't want to be there because this is probably a little bit sore.
Yeah.
But he can't get away. He's paralyzed. So he reaches up and bites me on the nose. And I jump up, and I have this paralyzed cat hanging off my nose. He won't let go. And that click, and he's swinging off my nose, and there's blood starting to come out. And the sisters are screaming. I'm killing myself laughing. It's the funniest thing I've ever seen. The vets come in. We're like, get the cat off the nose, you know, patch up the blood. Anyway, super funny. Moral of the story is about 4 months later, he was crawling, moving around, getting to his own litter. We never really got him walking very well, but we made him a little scooter so they could take him outside on his little scooter and get outside for some fresh air. So
that's
he
amazing.
lasted another couple years, and then something else got him. But that was my only bite in 15 years. Yeah.
Well, at least it ended in a positive note for the most part.
You guys are obviously very, very passionate about this field. So what would you say is the reason somebody should get into this field?
I think that there's not just a single reason, honestly. I think if you want to make a difference for an animal, get into this field. If you enjoy and are rewarded by a population that will do what you tell them to and will recover because you tell them to do it, get into this population. If you really just like petting dogs all day, get into this population. Like, working with them is so rewarding, and it just, personally, it makes me happy every day. So other than that, like, if you want good patients, fit patients, happy patients, and, you know, just a really adorable patients, then get into this field.
Awesome.
So I would add on to that, we have great compliance, right? And here's the other thing with animal rehab. We only have good owners, right? Crappy owners don't bring their dogs in for physio. So we only have committed people who will do everything you tell them to. So our compliance for appointments and exercises and home programs is way better than it is for humans, right? The humans, you know how hard it is to get someone to do a home program, but in the dog population, man, they've done it. They can tell you how many reps. They know what's going on with their dog. And so they're a committed population, and that's really, really rewarding as a physio, right? To have someone take what you say and do good things with it. And second reason for me is it's way more fun than humans. Like, it's just fun. It doesn't even feel like work, right? For me, I've been a physio over 30 years. It was like, if I see another sprained ankle, I'm going to have to shoot myself in the head. Like, I'm like, you start to get kind of in a rut, right? Yeah. You get a bit bored. It's like, oh. But then when you start treating animals, you got to think outside the box. You like, it's all totally different. So I want you guys to think of how you would do an eccentric load exercise for a dog's quadricep. Now, I don't probably expect you to answer that, but how would you get them? So, how am I going to get an eccentric load on a quadricep? Because I've got to strengthen the patellar tendon. There's a great question for you to sleep on tonight. So, I find it's brain stimulating, right? Yeah. I like treating humans, but I love treating animals. And I think we also make a difference in life and death with animals, because very often we have a sport population and we have an elderly population, and there is so much you can do for a senior animal that avoids euthanasia. Because so I have a lot of people that come in and say, if this doesn't work, we're putting him down, right? And so all of a sudden they see life come back into their pet, their beloved pet. And I often see them for 3 or 4 years after that point before they actually have to be euthanized. So it is literally changing someone's life. Yeah. There you go.
That's awesome.
Just like that, actually 2 or 3 weeks ago, their dog was paralyzed, basically. And then, you know, he started getting a little bit better. And then by the time, like 3 days later, he was, you know, not doing great, but he came to physio. 1 week later, you know, he was pretty much back to normal. And they disclosed to us, they're like, yeah, if physio didn't work, we were on our way to the vet to get him euthanized. Like, we were on our way. And sure enough, now he's good. He's 14 years old. He's probably going to live another few years.
Yeah. The oldest dog I treated was an 18-year-old golden. I have a lot of 16 and 17-year-old dogs. There is so much you can do for senior animals. Yeah.
I was going to ask.
So that's why I do it.
Do you put it down in normal years or dog years?
Those are human years. My last 222.
Wow.
That's crazy.
Oh, we lost that question.
No, we're just to kind of wrap it up a little bit here. Carrie, I know you want to try to get more information about animal physio, and I know you're part of the college, and not the college, sorry, with the CPA divisions. So you want to just tell the listeners a little bit more where they can find more information about how they can get involved?
Yep, that would be great. So everything is on the CPA website, and you will all be able to log in with your student ID to the CPA website. And then from that website gives you access to all the divisions. So you would just Google like animal rehab or ARD, so it's animal rehab division. And then you will come to the ARD page within that CPA website. And in there is all kinds of information about how to get started. It's all of the archived newsletters for the last 10 years. And a lot of them have information on how to actually start a business with canine rehab. All kinds of articles on case studies and different things. And then all the core curriculum courses are on there, plus all of the advanced specialty courses that we offer. So I would say don't wait. Like, you don't have to wait until you've been a human physio for 10 years and have done all your, your A's and B's and your manual therapy skills. Start now, because you're already the experts when you compare to what's happening out there right now. So you don't have to wait to become a perfect human physio to start your animal program. So just everything is on the website there, and we're happy to take questions at any time. And come and shadow somebody. If you find someone in your area on that site, you spend a day, because as soon as you spend a day, you'll be hooked. Like, it is so incredible to be treating animals. Yeah.
And if I can add on to that, the Animal Rehab Division has a Facebook page, and I have been recently curating a animal rehab kind of educational page on Instagram and Facebook called Pause for Thought Rehabilitation. So you can kind of go on there and follow it. Yeah.
Yeah, that's awesome. I was going to ask you that next, Lydia. I was going to ask you a little bit to tell everyone about that page. And I know you're putting out some content there, and I think that's great. It's really good. I look through all the videos, so I definitely encourage everyone out there to go follow it. Yeah. So, I mean, if you guys have anything else to say, or we can kind of wrap it up there.
Yeah. Go on. I would say just go onto the ARD Facebook page and friend us, because there's all kinds of stuff, and there's all kinds of international sites as well for animal rehab out there. So just start checking it out and get involved. It's a ton of fun. You'll never regret it.
Awesome.
Well, guys, we really appreciate taking the time to chat with us.
Yeah. Thank you so much. It's been awesome.
Thanks for having us.
Yeah, it's been informative, and Lydia, it's awesome to hear that you're doing great things, and you're definitely passionate. You can hear it in your voice and in the story, at the beginning of what you had to do to even get the placement. That's awesome. So keep doing what you're doing. We're lucky to have you as a classmate.
Awesome.
All right, guys, we'll talk to you later.
It was your birthday.
Happy birthday.
Happy birthday. All right, guys, thanks very much. We'll talk to you soon.
Thanks a lot.